An atrial septostomy is an interventional or surgical procedure used to create or enlarge an opening in the interatrial septum, establishing a controlled right to left or bidirectional shunt. Depending on the clinical context, the primary goal is either to facilitate intercirculatory mixing of oxygenated and deoxygenated blood or to decompress a hypertensive right heart. Here are the key indications. In congenital heart disease, in certain cyanotic congenital heart diseases, an atrial septostomy is a critical, often life-saving bridge to definitive surgery. Transposition of great arteries. Essential when the patent ductus arteriosus or existing ASD is restrictive, ensuring adequate mixing of the parallel circulations to improve systemic oxygen saturation. Tricuspid atresia, required to allow systemic venous return to escape the right atrium and reach the left side of the heart. Total anomalous pulmonary venous return, necessary when there is obstruction or restriction at the atrial level to allow pulmonary venous blood to reach the systemic circulation. Hypoplastic left heart syndrome, performed if the interatrial communication is restrictive, preventing pulmonary venous congestion and ensuring adequate cardiac output. In pulmonary arterial hypertension and right heart failure, which could be adult or pediatric, in advanced refractory PH or chronic thromboembolic pulmonary hypertension, a palliative atrial septostomy is utilized to decompress a failing hypertensive right ventricle, increase left ventricular filling, and subsequent systemic cardiac output at the expense of mild systemic desaturation. Reduce right atrial pressure and alleviate severe right-sided heart failure symptoms or recurrent syncope. The choice of approach depends heavily on the patient's age, anatomy, and tissue characteristics of the septum. Balloon atrial septostomy, Rashkin procedure. A balloon-tipped catheter is advanced percutaneously, usually via the umbilical or femoral vein, into the left atrium across the foramen ovale, inflated and forcefully pulled back across the fossa ovalis into the right atrium to tear the septum. Primary use is in neonates with combined thin septa, that is for urgent stabilization as in TGA. Blade atrial septostomy, PARC procedure, utilizes a catheter with a retractable microblade to incise a thick or restrictive septum before subsequent balloon dilatation. Used in older infants or children where the septum has become too thick or rigid for a standard Rashkin procedure. Static balloon dilation or cutting balloon septostomy, high pressure or scoring balloons are used to dilate a pre-existing or needle-created defect. Transcatheter atrial stenting, placement of a small bimetal stent across the septal puncture to ensure long-term patency, particularly useful in adult PAH patients where standard septostomies tend to close spontaneously. Surgical atrial septostomy, Blalock-Hanlon operation, a closed-heart surgical excision of a portion of the atrial septum. Largely historical but reserved for rare cases where transcatheter approaches fail or are anatomically unfeasible. When performed for PAH, the procedure creates a controlled right-left shunt. While this decreases systemic arterial oxygen saturation, the concurrent increase in stroke volume and cardiac output typically results in a net improvement in systemic oxygen delivery, alongside a significant drop in right ventricular and diastolic pressure.